Hashimoto's disease or Hashimoto's thyroiditis is a condition wherein the body develops antibodies against thyroid gland, which means the body is trying to destroy its own organ, and that is a very complicated problem which can result from a host of different factors. But the result of this antibody production is that the thyroid gland becomes ineffective in producing its hormones, which regulate most of the body's functions, metabolic functions. So that complex interplay of thyroid hormones with the other hormones in the body is going to regulate the metabolic functions of the body, which is going to be disrupted when there is antibodies produced, and that is going to destroy the gland's function and structural integrity. What causes Hashimoto's disease is a very complex question, because there is a complex interplay of our genes, our gut, and the environmental factors. And when these factors are favorable to the development of a disease, an autoimmune disease, that results in the symptoms of a specific autoimmune disease. For example, if it affects thyroid gland, the antibodies affect thyroid gland, it becomes Hashimoto's thyroiditis. If it affects the pancreatic islets, then that probably results in diabetes. So depending on the causes or the complex interplay, which I said, one will develop a specific kind of autoimmune disease. Now, there can be many factors which are probably the triggering factors, or one of the main reasons which initiate this process of developing antibodies and progression of disease. For example, it can be the presence of other infections or other autoimmune diseases, like probably celiac disease. It's found that those who have celiac disease also have other endocrinal problems or antibodies to other endocrinal organs. Or if the individual has a dysbiotic intestinal microbiome, that probably has some organisms like C. difficile, or maybe a bacterial or fungal overgrowth, or a dysbiotic flora which is favoring the development of what we call improper or impaired sensitivity towards certain peptides like gluten and gliadin. It can also be due to deficiencies in our diet of certain micronutrients like selenium, zinc, manganese, magnesium, vitamin C, or even low iron stores, which probably leads to the issues related to thyroid gland or hypothyroidism. It can also be triggered by episodes of trauma or stress. So there can be a lot of factors which all result in the development of Hashimoto's disease, and in functional medicine we try to get into the depths of these aspects to know what actually went wrong and where we have to focus, rather than just supplementing the thyroid hormone in such conditions. There are many symptoms which are the hallmarks of hypothyroidism or an underactive thyroid gland, which may include constipation, dryness in the skin, nails or hair, or brittle nails basically, or it can also lead to depression or chronic fatigue. It can lead to irregular monthly periods in a woman. And thyroid gland, if it is not functioning appropriately, that might also lead to a reduction in the overall metabolic rate, what we call basal metabolic rate. That might lead to a feeling of intolerance to cold, or a feeling of cold all the time. And these are very common symptoms, and the individual also finds it very hard to lose weight, and weight gain is very easy. The person has very great difficulty in losing weight, and this is a very classical symptom of an underactive thyroid or hypothyroidism. And specifically, patients with Hashimoto's will have a greater degree of resistance to getting back to wellness. and they will eventually get most of these symptoms in the course of disease. Unlike the usual diagnostic tests like thyroid stimulating hormone or TSH and testing the levels of T3 and T4, tri and tetraiodothyronine, we are also going to do some advanced testing in case of Hashimoto's thyroiditis, especially reverse T3 and thyroid antibodies like anti-TPO and anti-TG antibodies, which will give us an idea whether the body has developed antibodies to thyroid gland, and that will help us in planning the treatment protocol accordingly. The management of Hashimoto's thyroiditis is very complex. It starts from gut healing, basically, through elimination diets, or even doing some genetic testing to see whether the individual also has a celiac disease, and managing those aspects which are the diseases present along with hypothyroidism. That's very important to address them as well, to have a very faster and successful recovery from the disease. Second important aspect is checking for chronic stress through adrenal functions, checking the level of sex hormones, other endocrinal functions. That's also very important to know whether the individual is in chronic stress, because if those things are not addressed, just pumping more and more thyroid hormone will not result in an effective management of the disease. It will still lead to problems like a need for dosage escalation over a period of time. So addressing the other issues like chronic stress is another important aspect. The third important aspect in management of the disease is addressing nutritional deficiencies. As you all know, probably there are many micronutrients including selenium, zinc, magnesium, manganese, and also certain vitamins, vitamin C, D, and even certain amino acids. They are all very important in the production of thyroid hormone. Different stages of thyroid hormone production, they all have an important role to play. There is also a need to have optimum amounts of ferritin levels, so proper levels of iron in the body. These are all very important aspects, and they all are to be addressed when we talk about management strategies for Hashimoto's. And it is going to be a very complex mechanism wherein we include diet, lifestyle, like exercise, whether the individual is following a sedentary lifestyle or is he exercising, and proper supplementation. So they all come together in management strategy of Hashimoto's thyroiditis. You can get more information from our clinicians, so please visit www.hashtagayur.com or write to us at hashtagayur@gmail.com. You can see the information in the description box below. Kindly subscribe so you will also have access to our new videos which are educative, and you will also know when we have free webinars and health education programs from Ayur every month.